Hi, my name is Jessica Steiner. For the test review project, I worked on the Frenchay Dysarthria assessment. It was the first edition of the test. This test was written by Pamela M. Ederby, PhD, FCST. The test is copyrighted by College Hill Press Incorporated, and it was originally copyrighted in 1985. The price of the test is around $157 total for all the components. The components of this test include the test manual itself, a scoring graph, tongue depressors, stopwatch, tape recorder, glass of water, and pre-made word cards. The purpose of this test is to assess and monitor patients' dysarthrias that are associated with upper motor neuron lesions, lower motor neuron lesions, mixed upper and lower motor neuron lesions, extrapyramidal and cerebellar disorders. The intended population is normal, healthy adults. Throughout the initial test, there was a large age range that ran from teens all the way to the elderly population. The actual test includes a series of 8 tasks with some subtests. The first task is a reflex task. The subtests include coughing, swallowing, and dribbling/drooling. The second test is about respiration, and the subtests include respiration at rest and respiration during speech. The third test is about the lips. The subtests include the lips at rest, the lips spread, the lips sealed, the lips alternating, and the lips during speech. The fourth test has to do with the jaw. The subtests include the jaw at rest and the jaw during speech. The fifth test is about the soft palate, and the subtests include fluids, maintenance, and the soft palate during speech. The sixth test is the laryngeal test. The subtests include time, pitch, volume, and the larynx during speech. The seventh test is the tongue. The subtests include the tongue at rest, the tongue protruding, the tongue elevating, lateral movement, alternating movement, and the tongue during speech. The eighth test is intelligibility. The subtests include words and repetition, sentences and description, and intelligibility during conversational speech. There are a few factors that influence how these tests work. The influencing factors include hearing of the patient, sight of the patient's teeth and dental structure, language of the patient's mood at the time of testing, and the patient's posture during the test. To score the Frenchay Dysarthria assessment, there is a 9-point rating scale. Once the clinician administering the test decides the score of the patient, the score is then transferred to a provided bar graph. The severity rating can then be seen from the graphs by various patterns. A comment section can also be used on this form to include any additional information about the patient during the test. Preparation that must be done for the test is a little more extensive than other tests. Word cards need to be made ahead of time for the 8th task. There are 2 separate subtests that both require word cards to be made ahead of time. The cards should be made according to the specifications in the manual. The clinician must also have good knowledge of the entire test before administering it to any patient. This is to ensure that the test can run smoothly and that the patient can perform to the best level and receive the best scores possible. It is very important to avoid any bias from previous knowledge of the patient's dysarthrias. Because the patients that are tested are initially separated into groups regarding their dysarthria, it could be easy for the clinician to have a bias because they already know what the patient would present with during the test. It is also important to be aware of the influencing factors in order to best conduct the test for each individual patient. Because some of these influencing factors might affect some patients more than others, it is important to know your patient's dysarthria, and it is important to know how your patient's influencing factors really affect their performance on their test.